And then I invited them in. We had a meeting with management, and that issue was the promise to address. So what we've done with SBSC now is we've engaged them, and we are doing a pilot study using the GOP, our records, the physiotherapy department to see how beneficial it would be. Right now, they've made giant strides. We now have cards for each of those patients that can access information within seconds. When we finish this, we aim to now move into the laboratory. We had a health program on ground in the past. It wasn't robust. It didn't, you sit on your table, you access patients' data, but you can't get to see their x-rays. You can't get to see their lab results. And so you still need to resort to use of the case notes, which is what we want to discourage in last one.
I'm happy to be here. By way of preamble, I would say, I spent 25 years in the States on technology solutions across different platforms, not just for healthcare. Healthcare, I think, is a great candidate because it touches everybody. In terms of some of the more specific areas, I think just something as simple as patient registration, being able to share data across multiple locations where you don't come in each time and go through the same thing. The issue of your card is missing and lost all the time, even when you have emergency. So there are very peculiar and I think very simple situations where I think technology can impact the lives of everybody under this healthcare umbrella. But like I said, and I think that's it's an opportunity for SBSC, not just in healthcare, but across a number of other sectors where technology can make a big impact.
Definitely, electronic medical record system is the fastest way to go because the world is a global village and the technology is developing fast. We need to move in the same direction. Conventional records does not match up with what we have electronically. So therefore, if we're going to do things in that way, the waiting time of patient is longer when you use conventional records. The time that a patient waits to see doctor is also longer. But now, with electronic records, patients are seen and are registered fast and they see doctor. And the beauty of it is that once a patient is registered, it's registered for life.
Distinguished ladies and gentlemen, welcome to the Healthcare Senior Executive Roundtable hosted today by SBSC and the Center for Values in Leadership.
But I think we have the right players in the room. So this event is really a testament to SBSC's culture and our vision and what we are about. We have the ability to do things the right way, right? To provide healthcare solutions and any other solutions in the right way.
And you look at India, what has happened in India. I mean, lots of people are going to India, health tourism today, but we know that Nigeria has smarter doctors than the Indians all over the world. And so when I got a chance to see a group of Nigerians build a global company from the United States, doing work in Asia and everywhere, I really, my juices were stimulated. And so my association with SBSC was something that went in line with a dream that I had been trying to push on many fronts.
But the basic problem we had was free health, because to set up an IC program in a hospital like that, you need some financing. The Lagos State is aware of that. They had set up this e-health program, and I needed to take a risk and say, can we do something better?
We've really highlighted about 4 major issues. The first is essentially a lack of leadership. A lack of leadership in really building the will to leverage technology, whether it's electronic medical records, whether it's mobile health technologies, or whatever it is. You've got to bring people along a shared vision, shared vision of how this is going to be integrated into the system.
So from a design standpoint is where I believe our major challenge lies.
that we try to solve problems in bits rather than take a holistic approach to, first of all, map what the challenges are. What is this person doing?
How that would work with the EMR, because ultimately we still have to have the electronic medical records. Because once you have that, I'll just give an example. We have just one provider that we have an integrated EMR system with. And what happens is that in terms of case management, in terms of issuing them pre-authorization codes, it's almost at the speed of light.
And I said to him, the most important thing to us is partnership. We're not a vendor to Lawsuit. We want to be a partner to Lawsuit just to guide you and support you. Simple, basic things like that makes a lot of difference to organizations like us.
Monday was the day we broke the record, and Monday continues to be the most highest volume days.
All that record is gone. So as we progress forward, these are some of the advantages and benefits of the system that we will see.
I'm a big fan of SBSC because I really enjoy associating with an organization that's led with people of integrity and ability to execute.
There are so many low hangers that we can pluck, and ICTs has come to rescue a lot of the problems.
My problem, what are those things that I need to fix? What's the timeline do I have? What is the budget I have to deal with? Then I go back, do the analysis, come back to you, and I tell you, this is how I envisage that you should do. For me, now we're working together. And this is why I agree with Abdul here. When he's talking, don't go for vendors, go for partners. We're Nigerians, we're Africans, we'll make it work here. We'll build it, we'll customize it to the local environment.
I also hope that for those that couldn't attend, that we spread the word. If there's any listserv or if there's any group that we believe might benefit from actually getting this conversation and getting this sort of consensus statement, please share that with me, and we'll make sure that we meet with them and we actually share this information with them so that we're all sort of speaking the same language. And I think that is really key.